Hello, this is Shelley Bledsoe, and this is my health reform case study for Nurse 5010 Social, Cultural, and Political Considerations in Nursing. My presentation will go over the scenario I chose. It will cover the Affordable Care Act, Medicaid, TennCare, access to health care, quality health care cost, and key points. For my scenario, I chose the non-working uninsured female with a history of kidney disease. For purposes of this presentation, we will call her Lois. As you can see, individuals with a chronic condition tend to have high medical care needs and consequently account for a disproportionate share of healthcare spending. The Affordable Care Act of 2010 provides Americans with better health security by putting in place comprehensive health insurance reforms designed to expand coverage, hold insurance companies accountable, lower healthcare costs, guarantee more choices to the patient or consumer, and enhance quality of care for all Americans. Medicaid provides health coverage to approximately 8 million non-elderly individuals with disabilities. The federal statute provides both mandatory and optional coverage for people with disabilities. Medicaid recipients who are deemed disabled qualify for cash assistance under the Supplemental Security Income Program, and individuals eligible for Medicaid due to disabilities are also entitled to all services deemed medically necessary through a variety of delivery systems. This means Lois not only will get a supplemental disability income, but she will also get the care she needs when she needs it. A common misperception about Medicaid is that it is a health insurance program only for poor people, when in fact Medicaid also helps millions of people of all ages who have disabilities and need long-term services and supports. Lois certainly qualifies for Medicaid as far as her disability from kidney disease. So Medicaid is a joint federal and state program that helps with medical costs for individuals with limited income and resources, as well as individuals with disabilities like Lois. The services included are doctor's visits, prescription drugs, preventive care, along with long-term care services if you qualify for those with disabilities. While the scenario didn't indicate where Lois resides, I am assuming that Lois resides in the state of Tennessee. TennCare is the state of Tennessee's Medicaid program. TennCare provides health care coverage for 1.3 million Tennesseans and has an annual budget of $10 billion. TennCare services are offered through managed care entities. Medicaid managed care provides for the delivery of health benefits and additional services through contracted arrangements between state Medicaid agencies and managed care organizations, also known as MCOs, that accept a set per member per month payment for services rendered. Because the state of Tennessee has chosen not to implement a Medicaid expansion, people with disabilities can qualify for Medicaid based on their low income status if they fit into a coverage group. In this case, if Lois were a resident of the state of Tennessee, she would have no problem qualifying for TennCare due to being unemployed, uninsured, with a disability of kidney disease. Access to health care when you have Medicaid can be somewhat limited. Not all facilities accept Medicaid or TennCare in Lois's case. Outpatient providers that do accept Medicaid sometimes cap the number of Medicaid patients or TennCare patients they would be willing to see in a specific time frame. For instance, a specialist might only see 2 TennCare patients per week. Therefore, access to care, especially specialty services, may be harder to obtain and wait times may be longer. Quality is becoming increasingly important, and the Affordable Care Act has helped it to be so. Health insurance reform develops national priorities on quality by standardizing quality measurement and reporting, investing in patient safety, as well as rewarding providers for high quality care. This means Lois can expect to get high quality care despite her socioeconomic and disease status. States can impose copayments and deductibles on most Medicaid-covered benefits, both from the inpatient and outpatient services perspective, and the amounts charged to the individual vary with the income level. As you can see, this chart shows the maximum allowable copayments based on fiscal year 2013 for services rendered. So for institutional care services, the maximum amount of copay that can be charged is $75. And then the non-institutional care is $4 for physician visits, physical therapy, etc. Non-emergency use of the emergency room, the fee is $8. That is to dissuade people from using the emergency room as their primary care center. Also, you can see that preferred drugs versus non-preferred drugs have a price variance as well. Continuing our discussion on healthcare cost, long-term services and support, also known as LTSS, associated with chronic disease can be costly and wipe out a life savings. In most states, to be eligible for Medicaid LTSS, an individual must have less than $2,000 in assets. Lois does qualify for LTSS and has no out-of-pocket costs for health services due to no income and her disability status. It is important to note that Lois is still burdened with the cost of transportation, perhaps food while she's traveling to obtain these health services. Key points. I think in summary, it's fair to say that the United States was in desperate need of health care reform. The Affordable Care Act provides Americans with better health security by putting in place comprehensive health insurance through health care reform. Individuals with chronic conditions, such as Lois, tend to have high medical care needs, accounting for a significant share of health care spending. Medicaid is a program that helps with medical costs in individuals with limited income as well as individuals with disabilities. Access to care can be difficult for Medicaid or TennCare patients. Healthcare reform ensures all patients receive high-quality care. The costs associated with Medicaid are based on income and/or disability status. Here are the references used for this presentation, and I thank you so very much for listening to my health reform case study. Have a great day.